It's the station.
Okay, ma'am.
So if you've read and understood, considering it critical care scenario, please tell me, how would you manage this patient now?
I will manage this patient with according to ABCD assessment. First, I will check for the airway and then intake airway, then for breathing, like bilateral repair. Then I look for the circulation. Like after resuscitation, I will check for BP, pulse rate, and urine output. Then I will keep patient in cardiac monitoring in HDU. Then after since patient's potassium is very high, I'll do the according the management of hyperkalemia. Like I'll give calcium gluconate, 10% calcium gluconate, um, uh, 10 ml of 10% calcium gluconate over 10 minutes. Then I will give insulin with 50% glucose of 50% glucose. Then after I will give salbutamol nebulization or IV infusion. Then I will give calcium arsenium 15 gram per hour or 30 gram per hectare. Then
Okay. Can you please tell me, after you have read the stem, what are the provisional diagnoses that you'll consider? Where is this
my
patient suffering from?
provisional diagnosis is patient is having acute kidney injury
All right,
and
due
with
to?
due to it could be due to obstructive uropathy, and
All right.
second is since patient is in dementia, so might be he's taking less oral intake is there, so hypovolemia, less for fluid intake.
Okay. Right. Right. Patient has hyperkalemia. So please tell me, how would you or what measures would you take in order to manage patient's hyperkalemia?
Regarding patient hyperkalemia, I will give calcium gluconate 10%,
Yes,
10,
you told
10
me
ml
that.
over 10, yeah.
And
And second one for this to correct acidosis, I'll give sodium bicarbonate 50% of 50 ml. Then third thing I'll give insulin with
yes,
50% glucose. Then salbutamol infusion or salbutamol IV or nebulization.
okay.
Then I might if patient might need hemodialysis if the if your like TS level is less than 7.2 and potassium level is
Okay.
more than 6.5, then
What are the
calcium arsenium
what are the indications for dialysis? Can you name few?
dialysis uh, like if but for dialysis like potassium level more than 6.5 and PS level less than 7.2. If urea level is more than 30,
Yes,
then chronic renal failure with creatinine clearance less than 10 ml uh,
per minute.
per minute,
Yes.
and
Okay.
fluid overload, intoxication,
What
then
are the yes?
uremia.
What are the ethical considerations you'll keep in your mind before you'll decide that patient should undergo dialysis?
Since the patient is in dementia, he could not consent for his
Yes,
procedure. So I will take consent from two consultants
yes.
for the to proceed in the benefit of this patient, and I will also involve his family members, the staff nurse, and his GP and multidisciplinary team to plan for the further management.
What are the functions of potassium in the body?
They are in neuromuscular function, like muscular cardiac muscle function and nerve impulse function, then fluid and electrolyte balance.
Okay. What are the complications that can result because of the acute kidney injury?
Complication mainly are acute renal failure, that is increase in uric latent, which can result in multi-organ failure and pulmonary edema.
Yes. And
Uh,
all right. If you could tell me, right, if you could tell me what might be the causes behind acute renal failure in this patient.
in this patient, I think the because since patient is uh, known case of recurring UTI, it could be like obstructive
Obstruction.
uropathy.
Mhm. Yes.
Then because of dementia, he might be taking less fluid intake.
All right. If you could also tell me, all right, why should you be worried about the potassium level in this particular patient?
Because potassium, there are like it can cause in multiple complication in especially in cardiac, like there will be um,
Cardiac
uh,
arrest.
uh, cardiac arrhythmia and sometimes even cardiac arrest with a tall tented T-wave white QRS complex.
Yes.
And in regarding GI, there will be nausea, vomiting, diarrhea, and in
Can
regarding
even,
muscles, there
yes.
will be muscle weakness, muscle cramps, and flaccid paralysis.
Yes. Okay. For homeostasis of potassium, how can we achieve that? With
Mm,
diet and endocrine, if you could tell me.
Diet, regarding diet, like usually Western diet contains 20 to 100 millimole potassium daily, and endocrine regarding like aldosterone, which is secreted by zona glomerulosa of adrenal um, cortex, and it usually it acts on distal collecting duct and cortical distal convoluted tubule and cortical collecting duct, which act as like sodium and water retention, reabsorption with excretion of potassium. Then another is insulin. Insulin will insulin will um, I
Stimulate
mean
potassium.
stimulate the potassium shift inside cell
Yes.
to maintain its to decrease the serum potassium.
Levels. All right. Why is it important for you as a surgeon to know about the effects of potassium on
Uh,
the
du
cardiac
during
effects
like
of potassium?
uh, during cardiac surgery, potassium rich cardioplegic solution is given to make arrest during diastole, so that cardiopulmonary bypass can be achieved.
Okay. How high potassium can be seen on ECG?
Sorry, ma'am.
High potassium hyperkalemia can be
Uh,
interpreted or seen
like
on ECG.
it can be seen in wide QRS complex, tall tinted T wave,
Yes.
uh, and short PR interval.
In prolonged PR interval. Okay. And
That's right.
how about hypokalemia? How would you see that on ECG?
Hypokalemia, there will be inverted T wave. We can see U wave
Yes.
and white QRS complex with increased PR interval.
All right. Good. Thank you so much.
Mm, Thank you.